Hello, this is Colin Goggin. I am a doctor working with Unity Care in Ferndale. Today, we're going to talk about how you can lower your blood sugar and protect yourself from diabetes without taking any medications. By the way, blood glucose and blood sugar, same thing. Having blood glucose makes you feel bad. It can sap your energy and make you feel hungrier than you otherwise would feel. It decreases the quality of your future health by causing kidney damage, causing eye damage, even blindness, and can destroy your nerves, causing foot pain, numbness, wounds that lead to serious infections in the feet. High blood glucose also leads to high insulin levels, and the combination of high insulin levels and glucose causes increased risk of dementia, heart attacks, fatty liver disease, cancer, and strokes. Decrease your intake of simple carbohydrates because they raise your average glucose. Decrease your sugar intake, meaning eating less or even stopping consuming desserts, candy, sweet coffee, sweet teas, sodas, sweetened kombuchas, and energy drinks. Eat less processed carbohydrates, things made with white flour, sugar, or other starches like pasta sauce, frozen dinners, chips, processed potato foods like hash browns and French fries. Avoid types of fruit that are high in sugar or low in fiber like ripe bananas, grapes, raisins, figs, cherries. Here's some tips that I've found helpful when trying to do this without suffering too much. Drink water to decrease the desire for sugary drinks. Find flavors and food sensations to enjoy other than the sweetness of sugar and the salty starchiness of highly processed food. Soak up the crunchy satisfaction of nuts. Enjoy olives and avocados. Experience the spiciness of kimchi and salsa. Enjoy the bitterness of unsweetened coffee and tea. If you're able to take a break from sweet things altogether for 1 to 2 months, you'll likely see craving for the processed carbohydrates decrease. Take up cooking and preparing healthy food as a hobby. In addition to decreasing your intake of simple carbohydrates, you want to increase your intake of food that does not raise glucose. Take in food that is high in soluble fiber like oats, peas, beans, apples, citrus fruits, carrots, barley, and psyllium. Get in plenty of colorful vegetables, especially non-root vegetables. In moderation, enjoy fruit that is lower in sugar or higher in fiber, like papaya, apples, oranges, pears, peaches, blackberries, raspberries, blueberries, plums, apricots, and the pre-diabetic's favorite fruit, avocado. Choose foods that are rich in proteins like nuts, seeds, chicken, fish, meats, beans, and soy products like tofu and tempeh. Eat foods that are high in healthy fats like olives, avocados, olive oil, fish, especially fatty fish like salmon, mackerel, anchovies, sardines, haddock, trout, and tuna. Again, get in nuts and seeds which not only have fiber but also have healthy fats. Add in herbs and spices. Fenugreek, turmeric, ginger, cinnamon, and garlic. All of those have been found to decrease blood glucose, and others likely do as well. Consider using several daily additions or supplements that have been found to be effective at lowering your blood glucose. Green tea, 1 tablespoon of apple cider vinegar in a glass of water, vitamin C, that's 500 milligrams 2 times a day, and magnesium, 300 milligrams a day. Probiotics. My favorite are fermented foods. The 4 that I think about are sauerkraut, kimchi, kefir, and yogurt, because they don't necessarily have any added sugars or sweeteners. Get enough sleep. Less than 7 hours a night leads to high glucose and insulin levels. Extend your fast. Increase the time that you are not eating between the end of dinner and the beginning of the first meal of your day. Usually that's breakfast. Can you go 10, 12, 14 hours without eating it? The longer you can go, the lower your average blood glucose will be. One caveat, make sure that the hunger generated during the fast doesn't lead you to making worse food choices when you do eat. Get in exercise. All kinds of exercise work. Aerobic exercise burns up glucose while you're doing it, and resistance exercise builds up muscle, and muscle consumes glucose even when you're at rest. High-intensity interval exercise is the most time-effective way to reduce glucose levels. You can check out routines on YouTube or search for the 19-minute HIIT workout article by the New York Times on the internet. My final piece of advice is reduce stress. Use movement. Engage in practices like yoga, tai chi, and qigong. Meditation. Meditation can help you remain centered and cultivate inner peace. Mindfulness. Mindfulness can be used throughout the day to decrease stress buildup. You can use a journal, talk with a trusted friend, brainstorm on the internet for solutions, or work with a professional counselor. That's a lot to do. Are you feeling overwhelmed? Well, don't be. If your blood glucose is not where you want it to be, choose one or two of the things that I've mentioned here. Do it consistently and add more as time goes on. Baby steps can take you to your destination. You can do it. I know you can.